Okay, well, good morning, everybody. Thank you so much for the invitation to be here to talk this morning. I'm Rachel Littrell. I'm one of the cardiologists here on staff at the Truman VA, and I am going to be talking today about what I think every woman should know about heart disease. So today is National Wear Red Day, and I pulled off of the American Heart Association website that on the first Friday of every February, which is February, of course, is American Heart Month, they noted that the nation comes together in a sea of red. But since I'm from Kansas City, I think there are several reasons for there to be a big sea of red across the nation this week, right? So I was very happy to be wearing red at the beginning of the week, and I'm also very happy to be wearing red today to help support this very important day. So what I want to go through today is to talk just a little bit about what heart disease is in general and some of the differences in how it affects men and women. And we'll go through some of the numbers and statistics that I think every woman should know. We'll talk specifically about some of the signs and symptoms of heart disease, and then go through some of the risk factors. There are some risk factors that we don't have any control over, but fortunately there are a lot of things that we can change that can help influence our heart health. And then hopefully I'll leave you guys with some practical tips that you can start using today, even before you leave this room. So that's kind of the plan for the next 20 minutes or so. So we're going to start by talking about what actually is heart disease. So when we say heart disease, that can mean a lot of different things. It can mean heart rhythm problems, it can mean heart failure, but for the purposes of this talk this morning, I'm going to be talking specifically about coronary artery disease. So that means disease in the arteries that supply blood to the heart muscle. So those arteries supply blood and nutrients to the muscle, and they can become damaged by plaque buildup, usually cholesterol, and inflammation. And as that happens, the arteries become more narrow and the blood flow can't get through as well. So the heart muscle doesn't get the blood that it needs. That can cause symptoms. If an artery totally blocks off, that's what can cause a heart attack. And I thought you guys might be interested in seeing a picture. So when somebody has symptoms of heart disease or a heart attack, they might be sent to our cath lab for a coronary angiogram. And this is what that looks like to our interventional cardiologist. So the picture on panel A shows an arrow pointing to a very tight blockage in the artery. Can you guys all see that, how that becomes very narrow? So you can imagine that the blood flow has a difficult time getting through that very narrow passageway. The panel on B shows what that looks like after that blockage has been opened up, usually with a stent. And you can see now that it's nice and wide open. But this is what it looks like to our interventional cardiologist in the cath lab. So a lot of women tend to think that it can't happen to me. We don't always have this heart disease on our radar. And in fact, in 1997, the Heart Association did a survey, and only about 1 in 3 women were able to identify heart disease as the biggest risk to their health. Turn it off? Okay. Sorry. We have made some progress over the years. So they repeated the survey in 2012, and just over half of women were able to identify heart disease as the biggest threat to their health. So I'm going to show you guys some numbers and hopefully convince you that this is a really important health risk that all women need to be aware of. So heart disease is the #1 killer of women. More than 1 in 3 women has some form of cardiovascular disease. 5 times as many women die from heart disease as die from breast cancer. And it causes about 1 death per minute in our country. So that's more deaths for women as all deaths from cancer, chronic lung diseases, and diabetes combined. Here in Missouri, our risk of heart disease is actually a little higher than the national average. So this map sort of shows the risk of dying from heart disease by state. And so the lighter the color, the lower the risk, and the brighter the red, the higher the risk. And so here in Missouri, we actually rank 11th across the nation. Oh. Okay, thank you. Oh, wow. Can you guys all hear me? Okay, so on average, in Missouri, nearly 24 women die every day from heart disease and stroke. And it accounts for about 1 in 3 deaths of women in Missouri. So the truth is that it can happen to any woman. And it's also true that the risk of developing and dying from heart disease is a little higher in Missouri than in the national average. Okay, so now I want to shift gears a little bit and talk about some of the signs and symptoms of heart disease. So if I ask you guys to close your eyes and think about what a heart attack looks like, picture is probably what comes to mind, right? Because when you think about TV and movies, this is almost always how it's depicted, right? It's almost always a man, he's almost always white, he's almost always older, and he's almost always sort of clutching his chest in a very dramatic fashion. And it's certainly true that that's what a heart attack can look like, but that is definitely not always the case. I think there's a speaker coming later this afternoon, a woman who's going to tell her story, and I can tell you with certainty that her heart attack looked absolutely nothing like this. So let's talk about some of the signs and symptoms, and we'll go through these in a little bit of detail, but the important take-home message, I think, is that the signs and symptoms of heart disease in women can actually be very different than what they are in men. So when we think about heart disease, some of the classic symptoms that we think about are central pain or pressure in the center of the chest. I lost my mic. Here. Okay. Discomfort in the left arm or shoulder, shortness of breath, nausea, and weakness. Women may be more likely to present with less typical symptoms. So women may be more likely to have pain in the upper chest or back, pain going to the jaw or the neck. They may have shortness of breath. Flu-like symptoms can actually be surprisingly common in women. So you may have nausea or vomiting, or kind of breaking out in a cold sweat. Just being very fatigued or weak can come along with heart disease in women. And just a general sense of anxiety, loss of appetite, or discomfort. So you guys can see that these types of symptoms are often more subtle and can be harder to detect and easier to chalk up to some other reason. And in fact, women are more likely than men to just think that they, picked up a stomach bug, or maybe I'm just feeling too stressed because things are busy at work. And so women are much slower to come into the emergency department to get checked out when they are having symptoms. And once they're in the emergency room, because the symptoms are often less typical, doctors actually have a harder time diagnosing heart attacks in women because the symptoms are harder to pick up, and some of the changes that we expect to find on the EKG are not always there, less likely to be there, in fact, in women than in men. Okay, and then I'm going to take a little moment on my soapbox and just say that even in 2020, today, women are less likely to be treated with appropriate drugs for their heart attacks, even things like aspirin and beta blockers, which we know improve survival. Women are less likely to be treated with stents and bypass surgery and defibrillators. In fact, about a third of people undergoing those procedures are women, despite the fact that the prevalence of heart disease is about the same for men and women. Only about a quarter of people who participate in heart-related healthcare research are women. And most of the physicians making these decisions are men, so the number of female doctors is certainly growing, but the number of female cardiologists is only about 13% right now. And when we look at the doctors who are doing interventional procedures like putting stents in, it's about 4%. So it's true even still in 2020 that heart disease in women is understudied, underdiagnosed, and undertreated. Okay, so I'll get off my soapbox and just say that the take-home point here, I think, is it's important to be aware of the more subtle symptoms, and if your gut is telling you that something's wrong, don't hesitate to come in and get it checked out. We would much rather you get checked out and be told everything's fine than to ignore something that could potentially be life-threatening. Okay. So now I want to talk specifically about some of the risk factors for heart disease. Now, I think it's important when we think about risk factors that we kind of separate them into the things that we can't necessarily change and don't have any control over versus the things that we do have control over. So we can't change the fact that we're getting older. We can't change the fact that we go through menopause, and postmenopausal women are at higher risk of developing heart disease. Can't change your race or ethnicity. Can't change your genetics or family history. So you're considered to have an early family history of heart disease if you have a father or brother who was diagnosed with heart disease at an age younger than 55, or a mother or sister who has heart disease at an age younger than 65. So those are the things that may increase your individual risk of heart disease, but that we can't necessarily control. Fortunately, though, there are a lot of things that we can control, and we'll spend a little bit of time talking about each one of these individually. So specifically, smoking, high cholesterol, high blood pressure, physical inactivity, diet, and overweight and obesity. So before I jump into each one of those things, I want to just stress that this is actually really important. So one of my favorite studies that was done is a study that was published about 5 years ago now, and it was done in Sweden. What they did, they looked at over 20,000 men over a period of longer than a decade. And unfortunately, this study was only men, but as I've told you, that's actually kind of common in heart disease research. But what they found was that men who were able to achieve 5 low-risk behaviors were 86% less likely to have a heart attack. 86%, that's huge, right? So what were the 5 things? They followed a healthy diet, which they defined as having a wide range of fruits and vegetables and lean proteins. They moderated alcohol intake. So in this study for men, that was defined as less than 1 to 3 drinks per day. For women, that recommendation would be lower and would be limited to 1 standard drink per day or less. The men who were able to achieve this didn't smoke. They were also physically active, which they defined as walking or biking for at least 40 minutes a day. And then they had a waist circumference that was less than 37 inches. So for the men in this group who could achieve all 5 of those things, 86% less likely to develop a heart attack. And so the study authors concluded that almost 4 out of 5 heart attacks in men can be prevented with a combination of diet, lifestyle, and healthy body weight. So we don't have a single drug on the market that has those kinds of results, right? So let's talk a little bit about smoking. So here in Missouri, 1 in 5 women continue to smoke. So really the bottom line is, if that's you, please consider quitting today. If you smoke, you're 6 times more likely to have a heart attack than if you've quit smoking. Here at the VA, we have a lot of resources to help. There are some resources here in this room. There's web presence, texting, phone. So please take that step if that pertains to you. Cholesterol, about 40% of adults in Missouri have high cholesterol. And so it's really important to know whether or not you fall into that category. So if you're over the age of 20, you should have your cholesterol checked. In general, we check it every few years, and it may be checked more often. We generally check it at least once a year if you have heart disease, and it may be checked more often if your doctor is helping to adjust your medications. Okay, high blood pressure also is known as the silent killer because it doesn't have any symptoms typically. So here in Missouri, about 1 in 3 white women have high blood pressure, and over 40% of African American women have high blood pressure. And so this is something that it's really important to check because, like I said, most of the time it doesn't come with symptoms, so you may not know it. A normal blood pressure reading is considered less than 120 over 80, and the goal for most people is going to be less than 140 over 90, although that can vary a lot depending on your age and other medical conditions. Okay, and then when it comes to physical activity, only about 1 in 5 Americans gets the recommended amount of physical activity. So the American Heart Association recommends about at least 30 minutes a day, 5 days a week. And this can be broken up. They've done some studies and shown that you get the same benefit if you break it up into 10-minute or 15-minute segments and do it more than once a day. If you're aiming to use exercise to lower your blood pressure or lower cholesterol, then you need to strive for more than that, at least 40 minutes of more vigorous activity. When it comes to diet, 8 in 10 people here in Missouri don't get enough fruits and vegetables. And they've actually looked at this over time, and it's actually getting worse. So this is a really important area that I think can be addressed with some diet changes. And we'll talk a little more about that here in a few minutes. And when we look at obesity or overweight, almost 2 out of 3 women in this country are considered overweight or obese. It's really easy to calculate. You can calculate your BMI, and I think we've got some resources to help you do that here today. But losing weight, there's a direct correlation with lowering your risk of heart attack. So even if you can lose 5 to 10% of your body weight, which could be as little as 10 pounds, you can significantly lower your risk of heart attack. And losing the extra weight also helps manage blood pressure and cholesterol. So the bottom line, I think, with risk factors is that there are some things that we can't change, but are important to recognize. And there are certainly some things that we can change. And the vast majority of us, myself included, have room for improvement. And really, most of it is fairly simple, getting back to the basics of eating right and moving more. So this is really hard to read, and I apologize for the small text, but the Heart Association did a survey of women to try to find out what are some of the reasons that we don't all achieve these lifestyle goals. And some of the responses were, I'm overwhelmed with other family obligations. I don't think that changing my diet or my lifestyle will really lower my risk. I'm not sure where to start. I don't know where to go for more information. Too much confusion about what to do. If you watch the news, eggs are terrible for you one day and good for you the next. I think I'm losing my mic again. Sorry. But I think a good first step is just to talk with your individual healthcare provider, because that's not being done for a lot of people. So in 2012, they did a survey of women and asked if they had ever spoken with their personal healthcare provider specifically about their risk of heart disease. And even for women who were over the age of 65, only about 1 in 3 had talked with their doctor about their heart disease risk. And this is for the number 1 threat to women's health. So really important that we just start to have those conversations. A lot of women will assume that when they see their healthcare providers that their heart disease risk is being assessed. And it may well be, but that's not always the case. It's really important to ask. There's this idea in medicine that women's health has kind of developed along the bikini model, is what they call it, because we're really good at getting mammograms, we're really good about getting pap smears, we're really good about obstetric care, but we're much less good and much less thorough about looking into and treating heart disease risks, right? Okay, so let's move on and talk about some practical tips. So what are the important steps that you can take today? I think one of the most important things you can do is to know your numbers. I know we've got some resources here today to help track your numbers, but it's important to know your blood pressure, know your cholesterol, know what your BMI is. If you're diabetic, your A1C is another important number to know and keep track of. And then also just to literally take more steps. So all of the smartphones these days have step tracking devices. I see some Fitbits. So it's very easy now to track your steps and really to shoot for about 30 minutes a day, at least 5 days a week or more. And like I said, the Heart Association recommends at least 150 minutes of exercise. They also recommend adding some light weights or resistance training. That's important for women in particular for bone health. And even a little bit of activity helps. So the less time that we can spend sitting and the more time moving directly helps lower the risks of being sedentary. So if you're not active now, take some small steps to get started, even if it's just adding an extra 5 minutes of walking every day, and then slowly building up each day. When it comes to diet, I think it can be also very confusing. There are a lot of studies out there and publications, and there's a new diet rolling around every month or so, it seems like. There are a couple of studies, or a couple of diets that have been specifically studied with regard to heart disease. So the two that have been shown to lower risk of heart disease are vegetarian diets and the Mediterranean diet. But really, I think a good goal is just to kind of keep it simple. Aim for a wide variety of fruits and vegetables, choose whole grain foods, choose foods that are low in saturated fat and sodium. And if you're going to eat meat, then keep it to very small portions and choose the leanest cuts possible. And then I just want to remind everybody that women make up 80% of healthcare decisions for their family. So when you decide to make some healthy choices and healthy decisions, your loved ones will follow. So it's definitely never too early to start, and it's absolutely never too late to change. Okay, so I think that pretty much covers most of what I wanted to go over. The message for today, I think, which is Go Red Day. 1, get your numbers. 2, own your lifestyle. This is from the American Heart Association. Realize your risk. Recognize that heart disease is the #1 killer of women in this country. And so we are all at risk and should be aware of our individual risks. Educate your family. It can be, these healthy lifestyle changes are good for everyone in the household. And don't be silent. So thank you for showing up today in support of this really important day. And I hope you all go out and tell all of your friends. Okay? Thank you.